The NHS is one of the UK's most cherished institutions, but it's facing major changes. In a bold move, Prime Minister Keir Starmer has announced plans to abolish NHS England and bring it under direct government control. But what does this mean for patients, staff, and taxpayers? In this video, we'll break down the key points, the potential benefits, and the criticisms surrounding this controversial decision. NHS England, the body responsible for overseeing the health service, will be merged into the Department of Health and Social Care. This move is part of Labour's plan to cut bureaucracy and duplication, with the aim of saving hundreds of millions of pounds. The government claims this will free up resources for frontline services and reduce NHS waiting times. But here's the catch. Around 50% of jobs at NHS England and the Department of Health could be cut. That's a significant reduction, considering NHS England alone employs over 14,000 people. Keir Starmer argues that this change will bring more accountability, as politicians will no longer be able to hide behind quangos, organizations funded by taxpayers but not directly controlled by the government. The NHS has been under immense pressure for years, with long waiting times, staff shortages, and funding challenges. The government believes that bringing NHS England under ministerial control will streamline decision-making and improve efficiency. Health Secretary Wes Streeting says this will liberate frontline workers from excessive bureaucracy and competing directives. He claims the savings will be reinvested into patient care, delivering better outcomes for everyone. But critics warn that such a massive reorganization could distract senior leaders and create chaos during the transition. Sharon Graham of the Unite Union has called the job cuts an ill-thought-out strategy that could harm frontline services. The announcement has sparked mixed reactions. Conservative leader Kemi Badenoch welcomed the move but warned Labour that they cannot hide if things go wrong. She also pointed to Labour's management of the NHS in Wales, which she claims is underperforming. Liberal Democrat leader Ed Davey backed the plans but argued that the real issue is the lack of GPs, dentists, and social care workers. Meanwhile, think tanks like the Health Foundation have raised concerns that the reorganization could disrupt services. Even within the NHS, there's uncertainty. Sir James Mackey, who will lead the transition, admits the news is unsettling for staff, but believes it will ultimately benefit patients. This move isn't just about the NHS. It's part of a wider plan to reform the state. Keir Starmer has criticized the proliferation of quangos, calling them a cottage industry of checkers and blockers that waste taxpayer money. Since 2010, the number of quangos has fallen by more than half, but there are still over 300 across the UK. Labour has also created new quangos, like Great British Energy and Skills England, while suggesting cuts to the civil service. The Prime Minister argues that the state needs to operate at maximum strength to tackle global instability and rising costs at home. But critics like former head of the civil service, Lord Gus O'Donnell, say the government's messaging has been disastrous and risks undermining essential functions. So what happens now? The government says work will begin immediately, with the goal of completing the transition within 2 years. During this time, NHS England's functions will be gradually absorbed into the Department of Health. The success of this plan will depend on how well the transition is managed. If done right, it could lead to a more efficient and accountable NHS. But if mismanaged, it could create more problems for an already overstretched health service. The NHS is at a crossroads, and this decision could shape its future for decades to come. What do you think? Is this a bold step towards a better healthcare system, or a risky move that could backfire? Let us know in the comments below. Don't forget to like, share, and subscribe for more in-depth analysis of the biggest stories in the UK and beyond. Thanks for watching.